Welcome everyone to the SCHC Town Hall on the COVID-19 vaccine. I'm going to let our facilitator, Vanofa, introduce herself, and she will get us started. And I will be letting people in the meantime, so hopefully they're muted. If not, we'll try and mute them so we don't disturb everybody.
Hi everyone, welcome to this event. So before we begin, I just want to let everyone know that this event will be recorded and live streamed on the SCHC YouTube channel. So I'll give everyone a few seconds in case you want to turn off your camera or change your display name before we start. So thank you and welcome to our guests and panelists for taking the time out of your evening to be here. Just another housekeeping reminder, as Deborah just said, please keep your mics muted during the event. We will have a question and answer period at the end where you'll have the opportunity to speak to the panelists if you wish to. We do have a Tamil, Cantonese, and Mandarin translator available. So until then, you can put any questions you may have in the chat box and we will get to them during the Q&A. So my name is Vanofa, pronouns are she, her, and I will be your moderator and facilitator for this evening. So before we begin, I just want to acknowledge that the land this event is taking place on today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. We hope that you find this town hall helpful and informational. So to start us off, we welcome Dr. Nahid Dosani and Sabina Voya-Miller to speak on common COVID-19 questions relating to diversity. So Dr. Dosani is a health justice activist and palliative care physician with St. Michael's Hospital. He's also the lead palliative care physician with Palliative Education and Care for the Homeless, or PEACH, and Inner City Health Associates. He also teaches at the University of Toronto and McMaster University. With an educational background in clinical pharmacology and toxicology, Sabina is a co-founder of the Voya-Miller Foundation, a philanthropic endeavor with the goal of improving the health of people and the planet. She is also the founder of Unambiguous Science, a page aiming to counter misinformation to those without science backgrounds. And she is also the co-founder of the South Asian Health Network. So hi to Dr. Dosani and Sabina. The first question we have for you is, why is it important for to get vaccinated for COVID-19 in Scarborough? And I'll just pass it over to you.
Sounds good. Thank you so much. It's a real honor to be here today, and thank you to the entire organizing committee. It says a lot about a community that holds events like this. And so I think the first question is an important one. I'm sure Sabina will have more to add to it, and feel free to jump in anytime you like, Sabina. Maybe we can unmute and spotlight her as well. One of the things that we need to recognize is that the COVID-19 virus is not an equal opportunity virus. It has not impacted people equally in our society. We have seen a disproportionate impact on certain communities. And we've all heard about the tragedy in long-term care, and that's undoubtedly a superb tragedy. But in community outside of long-term care, the neighborhoods that have been hardest hit are those where people tend to have lower income, where people are more densely populated, racialized communities, and people who generally are impacted by what we call the social determinants of health. So how we live, learn, work, and play. And any part of society that has afflictions in those areas has been hit hard. They say pandemics are like guided missiles that impact communities that are low income and racialized. And we've seen that through COVID-19. And so why it's important to get vaccinated for COVID-19 is a question in and of itself. It is important to get vaccinated for COVID-19, but in communities like Scarborough that have been hardest hit, it behooves the community to have that extra oomph, that extra drive to get vaccinated, because these are the kinds of communities that have been hardest hit, from our ICUs to our emergency departments to just test positivity rates locally. We know Scarborough was hard hit. So I really do hope that people do get vaccinated.
Yeah, and I completely agree with Dr. Dasani as well. And we've seen that even in the South Asian community that I can speak for, given my role with the South Asian Health Network. We've seen that, the South Asian community and other racialized communities have been disproportionately impacted throughout COVID. And, we've seen this in wave one, we've seen it even more so in wave two. And I think what we've also seen, unfortunately, is that, our communities have also then been vilified and shamed because of some of these transmissions, when really it is because of all the structural barriers that our communities are facing and have been facing for so long. And if you look in, within many ICUs across GTA, especially in areas, in Toronto and Scarborough and Peel, we'll see that they're predominantly racialized, right? And very often we see people from the same families in the ICU together, because I mean, I'm Punjabi and my father lives with me and he's high risk, right? And there are many of our community members that live in multi-gen housing. And so what happens when someone who's working in the front lines as an essential worker, brings the virus home? You're basically impacting everyone that lives in the house. And that's why we see that our communities have been so disproportionately impacted throughout the pandemic. And I'll tell you honestly, I'll be very honest, that my concern as someone from the South Asian and the racialized community is that I just don't want to see my people being left behind, right? And it's the same with vaccines as well. And that is why we do so much education and advocacy to make sure that our communities are not being, hard hit even more so going forward. I think that is so important to make sure that we are protecting our community members going forward. We've already borne the brunt of it. We just can't anymore.
Thank you. So our next question is the vaccine safe for people of all races and ethnicities, and has this been tested?
Yeah, great question. And maybe I'll take that in the heat if you have something to add. Okay, so I do want to say, first of all, historically, a lot of the clinical trials were predominantly done in white men, right? And so over time, we said, okay, what about women? Can we also be part of these studies? Because we don't know how these, whether these medications are safe in women or effective in women. We don't know, right? And so we slowly started adding women to clinical trials. And then we're like, hang on a second, these can't just be, with demographically just right. We need to ensure that we are looking at efficacy and safety in our diverse communities and populations. And so in these studies, with the mRNA, Pfizer and Moderna, almost 20, it's slightly higher, in fact, than 20% were actually from racialized and ethnic communities. Similarly, in AZ, the AstraZeneca Oxford vaccine, it depended on which site you were in, but it was between, I believe, 8% to around 34%. And the J&J, the Johnson & Johnson vaccine, was around 35% in terms of having ethnic groups included. And I know these numbers sometimes will be like, well, shouldn't we be 50%? And absolutely, we should be more. We should be, we should in our clinical trials be highlighting what our communities look like. They're diverse, right? But I do want to remind everyone that these were large clinical trials. We had 20 to 40,000 people in each of these studies. And so if we're looking at, 20 to 30% of that, there were really high percentages of diverse and ethnic communities. And here's the most important part that everyone needs to remember, is that there were no differences in efficacy or safety amongst any of the racialized communities. And so across the board, we saw that the vaccine worked the same way, and there was no additional safety concerns with communities of color. The only one caveat to that I do want to talk about is that in the J&J, you'll see slightly different efficacy numbers in the studies that were done in Latin America and in South Africa. And that really had to do with the variants, because we know that both Latin America and South Africa have some of these variants of concern that the vaccines are not working as well. We see slight decrease in effectiveness in this, but that was due to the variants. But other than that, across the board, there were no differences in efficacy or in safety.
I think sometimes, I think Sabina's covered that really well, but at the heart of the question, why are we asking about where people of all races and ethnicities tested, is because there's an understandable mistrust of healthcare. There's an understandable disconnect that people from racialized communities often have of government, of institutions, of healthcare, because many racialized people across Canada and many countries around the world have been let down by institutions and in healthcare. And what we're trying to do with sessions like tonight is convert that mistrust into trustworthiness and build those relationships to really get at the core of what this is. And that's that we need to build that relationship and trust and rapport so people do take the vaccine ultimately.
Thank you. Yeah, so our next question is slightly similar. So are Black and Indigenous peoples getting the same vaccine as doctors and white people?
I think that's a very fair question. Yes, absolutely. Black and Indigenous people are getting the same vaccine as doctors and white people. Understandably, because of storage requirements and transportation issues, there are some people who are getting one vaccine versus another, but it is not that particular communities, either by geography or race or social economic background, are being targeted for certain kinds of vaccines. So these kinds of concerns, it's a very fair question and one that needs to be answered, but there are no differences between Black and Indigenous people and what other healthcare providers or white people in our communities are getting. It's pretty much, there's equity across the board.
Yeah, and maybe if I could just quickly add to that also is that sometimes when we're looking at effectiveness, we look at these numbers and we're like, wait, that one's 95%, but this one is like 75%. You know, does that make it less of a vaccine? And I think what we need to remember is that in all of these studies, we didn't look at the same endpoint. Like in some studies, we looked at whether it, was able to prevent any symptoms, even if it's just one symptom, even that could be runny nose, right? Or sore throat, and that's it. And in other studies, we look to see whether it prevented severe disease or hospitalization, right? And so when you're looking at these numbers, you have to ask, what was that number 95% talking about? Was it just talking about any symptom, or was it talking about severe disease, right? And so it's not actually a fair, accurate comparison when we're looking at the different vaccines. But what I'd love to just make sure that everyone understands is that with all of the 4 vaccines that we have approved in Canada right now, every single one of them was so highly effective in preventing severe disease, in preventing hospitalizations, and basically across the board, they prevented deaths, all of them, 0 deaths caused, either by if you got the any of the vaccines, you basically prevented death, and that is just so incredibly important for us, because we've seen, how dangerous COVID can be, and knowing that the vaccine, all of them prevent these severe outcomes is so important, and they all do it really well.
Thank you. So our last question for you, what are some religious objections to getting the vaccine, and how do those concerns weigh against the potential risk or harm to the population?
Okay, so maybe I'll take the first half, and then Nahid, I'll have you do the second half. Okay, so I can talk to you about, what we're hearing a lot from the South Asian communities, right? And so, very, very often we get the question, hey, do these vaccines contain any animal products? Are there any cow products? Are there any pork products? Are they halal? And so, I'm really, really pleased to say that actually these vaccines have no animal products, and there's no cow, there's no pork, there are halal. The other question that comes up very often is that, are there any blood products, or are there any fetal cells in these vaccines? And so none of the vaccines have any blood products or fetal cells. Now, with the, you will hear some people say that, well, fetal cell lines were used to manufacture the J&J and the AZ vaccine. But this is just as a reminder, when you use things like fetal cell lines, you're just using it to grow the virus, because viruses, they love growing in human cells, right? That's what they do. And so we need to use human cells to be able to grow these viruses. And that's what we're doing in the lab to make the vaccine. But then what we do after that, once we've grown it, is we actually purify it. We clean it all up, and we make sure there's nothing else in it. So there's no fetal cells or any of that. It's just basically the vaccine. And when we look at what's in the vaccines, that's really what it is. We're looking at, basically what helps make us the spike protein in our body. So it's actually not even the full virus. It's just like something that codes for for the spike protein that is on the surface of the virus. So that's all it is. And then it has other things like lipids and cholesterols, which basically make this really nice fat bubble, so that it helps get into our cells better. And then it has things like sugars and salts. And these really just help make the vaccine balanced and stable, so that when it's given to you, it does not, it actually does what it's supposed to do and doesn't disintegrate before it actually does what it's supposed to do for you. So really in the vaccines, there are nothing in there in terms of actual anything of concern at all in there.
And just to, Sabina, you answered that fabulously well, better than I could have, no doubt. I think that the big question, though, is how do these concerns weigh against potential risk and harm to the population because of the pandemic? And I will say that the alternative to getting the vaccine is to get COVID. And getting COVID is a risky proposition for people in our society. People will get sick and people will die. You are much more likely to experience the bad consequences of COVID than bad consequences of the COVID-19 vaccine. And that's worth it. Not to mention the collective effort that we all need from people in our communities to really gather, to collectively come together to create herd immunity. So our communities are immune to COVID because we'll only beat this together. And the pathway towards that is vaccination.
Thank you so much. That was really helpful. So now we'll move on to our next section. And I would like to welcome Ria Rama and Jan Munir, who are both outreach workers with SCHC's COVID Equity Action Plan. So I'll pass my first question on to Ria, which is, what exactly is the COVID Equity Action Plan?
Hello, everybody. The COVID Equity Action Plan is an emergency response plan that was funded by the City of Toronto and the Ministry of the Public Health. And the main focus and objective is to stop the virus of the COVID-19 and to deliver immediate emergency response to our community members out there that were hit with positive incidents. And the plan is to connect the community members with the information and the support that's available from the city. I hope that in a nutshell answered the question.
Thank you. So I'll pass the next question on to Jan, which, so what are the services that the COVID Equity Action Plan provides specifically?
Oh, thanks, Munifa. So we have a number of services that we are providing to our population in Scarborough. I will name here a few services. These are very important. And the first one is the access to masks and hand sanitizers. We are providing PPEs to subsidized buildings, grocery stores, and we are also, providing these PPEs to racialized communities, as discussed earlier. Specifically, I will mention here South Asian population or Southeast Asian population, Middle Eastern people, African people. So because they are the hard-hitting community, we are providing them free PPEs and hand sanitizers. Apart from this, we are also providing them access to testing sites and including transportation. If they have any difficulty reaching to assessment center, we are helping them regarding transportation. And also we are giving them awareness and information on how to stay safe during the pandemic period. This is also done through our project. And we are also providing them information about voluntary isolation centers. So there are people, if they don't have any space in their apartment, their homes, so we are connecting them to isolation centers so they can go and safely stay, those designated places. And the last thing that is very important, we are also giving them information about COVID-19 vaccination. So these are the things that I mentioned we are doing so far.
Thank you, Jan. So I'll pass it on to Ria again. I think it was briefly mentioned, but what do you mean exactly by wraparound supports?
Wraparound support is a team-based plan process that we provide with our support to our community members. If a community member is tested positive, we have a support system to provide them, for example, how to isolate, the PPP that they need, food, income support, access to other programs that we provide within our organization. That's in a nutshell what's the wraparound support that we provide.
Thank you. So back to JAM. In addition to SCHC, what are the other agencies doing this work in Scarborough?
Okay, so there are three organizations. They are providing services in Scarborough. Apart from SCSC, SCSC is providing services from 401 to South Side. So there is only one organization. This is on South Side of Scarborough. The North Side, there are two organizations. One is Malvern Family Resource Center, and other one is Taibo Community Health Center.
Thank you. So for this program, I'll pass it on to Ria, sorry. For this program, does a doctor have to refer you or?
No, not necessarily. Every person can refer themselves to our program. They can use our brochures information, our email, our online platform. They can contact us, we'll contact them back, and we can proceed from there for every individual client member by themselves.
Thank you. So back to JAM, if a group or a religious committee, for example, a church, is interested, can someone from your committee go and give a talk?
Oh yeah, I mean, thank you. And this is really a very important question. Well, I will say we are quite flexible. We can contact, and we are contacting every individual, any family, any ethno-based organization, faith-based organization. So we are contacting everybody, and we can contact everybody in future as well. If somebody wants to contact us, we have people, and we speak, number of languages, and we can contact them, and we can provide them services based on our resources. So yeah, everybody can, have our services without any discrimination, for sure.
Thank you. Back to Ria. So this is specifically on isolation sites. Do you have to go to an isolation site if you test positive and the rest of your family is negative?
Not necessarily. The isolation sites are provided as a further support for our community, and we are also are there to provide support in case if the person cannot isolate by themselves. They have to be within their family. We are there to support them while they're isolating within their family in order to keep everybody safe at the same time. Yes, that's what we're there for. That's what we're trying to do out there.
Thank you. So this is for both of you. I know you've both had the vaccine. So if you can each just talk about what it was like, whether you had any side effects, anything else you would like anyone to know.
And you want to go ahead first? Okay.
Sure, go ahead, Jan.
Okay. Well, I mean, I will say this is $1 million question. In fact, so since I got vaccination, I got, millions of calls. I received calls from my friends, family. They want to hear my experience. Well, I will say this is a very positive experience, wonderful experience. And I will recommend everybody should go when the time comes. And it's only 2 minutes. In fact, there are 3 stages. Let me tell you one. So when you go there, I think there's a nurse. She will interview you for 5 to 10 minutes. She will ask you just basic question. If you're taking any medicines, sort of these things, she will ask from you. It's going to take only 5 minutes. The second stage is that then you will go to another room. You will get a vaccine. It's going to take only 2 minutes. And slightly, a little bit pain on your arm, whether right or left, nothing. The third stage is that, you will be directed to go to a room where they will observe you for 30 minutes, right? You will be there for 30 minutes. The nurse will keep asking from you every 10 minutes, how you're feeling, if you have an allergy. And then, they will give you a second appointment because, you have to have a second dose, maybe after 35 days. So I will recommend, everybody, you should have this vaccine. So if you have this vaccine, you can save yourself, your family, your friends, your neighborhood, everybody. So I will recommend it strongly for everybody. Thank you.
On my end, it was a positive experience. The frontline workers were extremely supportive and kind to me, especially with my efforts to be there with we all. And other than the arm pain for like the next day that went away after 2 days, it was gone. Nothing. It was other than that, there was nothing else going on. It was good experience in general.
Thank you so much, Ria and Jam. So now we'll move on to the next portion of our event, which we'll talk more about the vaccine and its myths and facts. So for this section, I welcome Dr. Bedri Ahmed. Dr. Ahmed completed medical school in Ethiopia and has worked in different levels of public health before moving to Canada. Here, he completed his training at the University of Western Ontario and has worked at the Rouge Valley Health System before joining at CHC as a primary care physician. So our first question for Dr. Ahmed, how was the vaccine developed so quickly and was it rushed?
Thank you, Vinova, for inviting me to this great town hall, and thank you everyone for showing up today. It's a collective, we do have a collective responsibility to respond to the current pandemic, and we all are seeing light at the end of the tunnel. Yes, let's go back to the vaccine. Was the development of this vaccine rushed? It's a very good question. The development of this vaccine was relatively fast, but it was not rushed. It did not skip any step to be approved. It followed the same rigorous procedure as in any other vaccine. The scientists had the knowledge of how to make an RNA vaccine from before. They used it for different viruses in the past. Like they used it for Zika virus, flu virus, rabies virus, CMV virus, and even in some cancer treatment. So the knowledge is not new. And what was new was the global demand for a vaccine to combat this pandemic. And there was a huge funding to run a very high level clinical trials to come up with a very effective vaccine, and it was done in a very short period of time. And then it was evaluated at higher levels by regulatory authorities, and it was deemed safe to be used for general public. Otherwise, it did not skip any step to be available for general use.
Thank you. So the next question was touched on a little bit, but can you speak more on what the vaccine is made of?
The vaccine is made of an RNA. What's RNA? RNA is a piece of sequence, which it's like a recipe, which tells your cell how to prepare some sort of a protein. Now, the mRNA is packaged in a lipid or fat bubble. They talked about whether this is halal or haram. I can talk about it too. That fat bubble, what it does is it just helps the RNA sequence to get into the cell. And once it's inside the cell, what this messenger RNA does is it teaches your cell to prepare a harmless piece of the spike protein. You know, you have seen the coronavirus, it has spikes. That's what it makes. That's what it makes. That's not a virus. That's not a virus at all. Once that spike protein is made, it comes out of the surface of the cell, and that's when our immunity identifies it as a foreign object and starts making antibody to protect further attack from spike protein or as a virus that comes in with the spikes. And
I have a question.
yes, so
I have a question.
Okay, we can ask question. Let me explain the mRNA vaccine. That's how the mRNA does its work. Once the mRNA encodes or transcribes its effect, what the cell does to the mRNA is it just destroys it. It does not have any relationship with our DNA. Our DNA is locked in a safe called nucleus. It does not have any interaction with our DNA. This is just a recipe that trains or teaches our cell how to prepare the spike protein.
Thank you. And just a reminder that we will be taking questions at the end for all our speakers. So the next question for Dr. Ahmed that I have here is, how effective are these vaccines? And what is the point of getting the vaccine if it doesn't provide 100% protection?
Excellent question. And the speakers earlier touched on it. Sabina talked about the effectiveness of vaccines. These vaccines are amazingly highly effective. Let me, before I talk about the effectiveness of these vaccines, let me tell you a story about our long-term care. You've seen how things were during the first wave and the second wave. It was chaotic. Have you heard the news in the last 4 days? There was no single death from our long-term care in the last 4 days. This is amazing. This is the effect of the vaccine. The Ontario government prioritized long-term care residents to get their vaccination, and we are seeing the effect of that now. It's preventing death, hospitalization, and severe disease. What these vaccines do is, it's not just, we don't have to see the percentage of the effectiveness of the vaccine. As Sabina said, some of them were tested. Does it prevent a runny nose? Does it prevent sore throat? Does it prevent severe symptoms? But if you look the end point is severe disease, hospitalization, and death. None who had any of these vaccines, either Pfizer, Moderna, J&J, and AstraZeneca, none of them had hospitalizations, none of them got severe disease, and none of them died from it. So what we hear in the community, 60 to 70%, some of them 90 to 90%, that's more of technical than the actual endpoint result. So all of them, the vaccines that have been approved by Health Canada are highly effective. When it's your turn, we do have a collective obligation to make sure that we get the vaccine and keep the pandemic under control. And there are some indications now. Let me give you another information. CDC 2 days ago suggested that people who had vaccine might get closer without wearing a mask and a glove. Today, Dr. Fauci said, we might probably get out of this lockdown off situation before we build herd immunity, because people are becoming very optimistic. These vaccines are highly, highly effective. Sorry, I took a long time. I'm excited.
It's okay. So our next question, again, you did touch on a little bit, but is there a better vaccine, and is there a difference between the different manufacturers?
The difference is how they are made. One is, two of them, Moderna and Pfizer, are RNA vaccines, and J&J and AstraZeneca are, they follow the traditional way of vaccine. None of them have live vaccine. That's the most important thing. None of them have live vaccine. None of them will give you COVID disease. None of them. It gives protection. The second part of your question is, if there's any difference. The difference, we talked about it. It's just we can talk about the side effects later on. There might be minor differences in that area. Otherwise, they are all highly effective.
So the next question is, are these vaccines effective against the various or any new COVID-19 strains that might come up?
What makes the Pfizer and Moderna or the mRNA vaccines different from all other vaccines we have known before is it's adaptable. It's, when we say adaptable, we can change the vaccine quickly so that we can adapt to the new variant. If there is a new variant, we can adapt it. They can modify it, and we can get good protection moving forward. And the mRNA vaccines, they do have, it has been shown that they have a good protection against the variants. That's a good thing. For AstraZeneca and J&J, we actually got them while the variants are already in the community. So the research was recent, and both AstraZeneca and J&J said they have some efficacy on the one on UK. For the AstraZeneca, they said, okay, there might be some reservation or some being not effective with the South African, but it's still being used with high efficacy. So far, we have not had any significant issues when it was used in Europe.
Thank you. So our next question, are there any side effects? And if so, how long will they last?
Okay, the side effect, let's divide it into minor side effects and severe and serious side effects. The serious side effect that we all are afraid of, everyone is afraid of, is serious allergic reaction or anaphylactic reaction. That's serious, but how often does that happen? It's extremely, extremely low. It's extremely low. Some experts indicate that these things might happen at a rate of 1 in a million. Now, if you look into the global vaccination rate, over 300 million people got vaccinated around the world. How many people died from this? We don't have, it doesn't even make the news. It's not, we don't see any major issues. In the state alone, close to 100 million people, got vaccinated with both Moderna and Pfizer, and J&J is going to be in practice very soon. So these are very highly effective and safe vaccines that we have in the community. And yes, let's talk about the minor side effects. I had it myself. To be honest, the only symptom I had was the second day I had some soreness at the injection site. Yes, to be on the safe side, I took Tylenol. I did not miss work. I did not miss my daily exercise routine. Everything went fine. After the second day, I did not have any sore shoulder. I did not have any issues. Some people might get some aches and pains, muscle pain. They say the second shot might probably give you more symptom. But now Ontario extended that gap to four months. That also reduces the risk of getting side effects. It's good that Ontario and some province extended it to 4 months.
Thank you. So our next question is anyone restricted from getting the vaccine? For example, pregnant or nursing mothers, specific allergies or anything like that?
The only restriction that we have for this right now is if a person had anaphylactic reaction to the first shot. For example, someone goes for a shot, a Pfizer or Moderna. If that person had a serious side effect from the first one, that person is not allowed to get the second shot. That's the only person. And that we discussed, like, that's probably 1 in a million. That's not a very common side effect. The rest, if you get minor symptoms and side effects, you can still get it. For people who are pregnant or nursing mothers, they weren't part of the research or investigation. But once this vaccination rolled out, a lot of people had it. Pregnant mothers. We have colleagues in medical community, pregnant and who had it and took the vaccination, nursing, and also get the vaccine. Because not getting the vaccination and the risk of getting COVID is serious at this time than getting minor side effects from the COVID vaccine. As I have earlier said, it does not contain live virus. It does not contain live virus to give you COVID or to affect your child or to cause serious consequences in the growth and development of your child.
Thank you so much, Dr. Ahmed. That was very helpful and informational. So for the next portion, we'll move on to specifically Scarborough's vaccine campaign. And for this portion, I welcome Dr. Abdel Balhaj and Michelle James. So Dr. Belhaj obtained his medical degree from the El Fateh University in Tripoli, Libya, and continued his studies at McMaster University with residency training in medical microbiology. He is currently the Medical Director of Infection Prevention and Control at Scarborough Health Network's Centenary site. Michelle James is the Vice President of People and Transformation at SAGEN and has worked here for 13 years. Michelle has contributed to the health sector for over 30 years in a variety of settings, including hospitals, the Ministry of Health, and as a health management consultant with IBM and PricewaterhouseCoopers. So for the first question I have for both of you is, when and how will I get the vaccine, specifically in Scarborough?
Hello, everyone. This is Abdel Belhaj. I'm the medical microbiologist and infectious disease consultant at the Centenary site of SAGEN. What I want to say that we don't want to keep the vaccine in the freezer. Once we have whatever we have, we're gonna put a needle in our arm right away. So we are following the province guidelines. So they are going from phase 1, phase 2, and 3. We are still now in phase 1 of the vaccine campaign, which is still underway for long-term care resident staff and caregivers there, and also other congregate care setting for seniors like retirement home, frontline healthcare workers who are at high risk to acquire or to give the virus to somebody else, adults who are receiving ongoing home care, indigenous population, etc. These are the population who are included in the phase 1. Phase 2 should start in April, and it will begin with those who are 79 years old and going in decreasing 5 years increments. Phase 3 will start in July, and that will include all remaining Ontarians. There are four vaccines are available now, and as you know, Pfizer, it's been available for some time. That's what we're using at Centenary Clinic now. Moderna, it's also been available. We give it to the resident and nursing home, and we just got approval of J&J and AstraZeneca. We don't have it yet, but once we receive it, if we receive massive amount of vaccines, we will roll it right away. The time it may be before what is planned, but then depends on the number and the amount that we receive. We don't want to keep vaccine in fridge or in freezer. Once we receive it, we give it right away. I asked Glenn, who's the lead for vaccination campaign at Scarborough, and she mentioned we gave so far about 30,000 shots in Scarborough. Michelle, do you have anything to add?
No, Dr. Belhaj, I think that's a great answer. The important thing is that the answer is really, it depends what group you fit in terms of when you'll get your vaccine. With over 600,000 people living in Scarborough, it's just impossible to vaccinate everyone at the exact same time. So there had to be a way of just prioritizing or putting people in a queue. So we're doing the best we can to go forward as quickly as we can.
Thank you. So the next question we have is, are all vaccination sites getting access to the same vaccine formula?
So I can answer because it may change at any time, but right now we have Pfizer for all vaccination sites. I don't think we received the Johnson & Johnson or AstraZeneca yet, and we have Moderna that we give it to the nursing home resident, but it's mainly Pfizer. Once we have more the other kind, so we will enroll it too, but we have Pfizer now.
Mm-hmm. And I could add a little bit to that one as well. Definitely Scarborough Health Network has Pfizer, and we had a bit of Moderna when we did the long-term care residents. There will be AstraZeneca available to a subset of the population in Scarborough, but it won't be through the hospital. They're doing some pilot tests of the new AstraZeneca vaccine, and they'll be giving it to pharmacies. So there'll be certain pharmacies. Unfortunately, I don't know the exact pharmacies, but pharmacies will be distributing AstraZeneca to people between the ages of 60 and 64. So a very specific group.
Thank you. So the next question we have is, how will I know if I'm in a priority group to get the vaccine?
Most of the people who are in phase 1 will be notified through their residence, if they are resident in congregate setting, or through the workplace if they work in an area that it's required to get so. And once we go to the phase 2 or phase 3, you will hear about it, likely in the ministry website and the news, but right now we are still in phase 1.
So the next question is, what do I need to get the vaccine? For example, does it cost money? Would I need a health card? Things like that.
The vaccine is free of charge. And once it's available to everyone. If we don't ask for the health card. There is no insurance required, no fees for it. Once it's available, it's free. And as I say, I'm going to say it again, we don't want to keep vaccine in a fridge or in a freezer. We want to put a needle in the arm right away. Mass vaccination is very important. Once we reach high level of immunization, we will develop the herd immunity and we will control the pandemic. In Israel, they have about 90% of the population vaccinated, maybe more now, and they have about 90% decrease in symptomatic infection, severe infection, and hospitalization because of COVID, and that's what we want to see. I want to see mass immunization to start as soon as possible. Hopefully we'll have large amount of vaccine and we will give it right away, because once the lockdowns start to be loosened now, we start to see some COVID cases comes to the hospital again, and we want to prevent that with mass immunization.
Mm-hmm. Yes, the one thing we do need though, Vinova, just to add, is some way of contacting people, because the Pfizer, Moderna, and AstraZeneca vaccines, they all require 2 doses. So when you come for the first dose, we need some way of, you will get the appointment typically when you leave, but we want to follow up with reminders, etc. So usually you will be asked for some kind of contact information.
Thank you. So kind of relating to that, our next question is, can each dose be a different vaccine? So for example, Pfizer for the first dose and then Moderna for the second dose.
The vaccines are not interchangeable. So if you get Moderna, you're gonna get Moderna. If it's Pfizer, you get Pfizer. The only thing is the duration may be changed. Right now, we're gonna use 4 months, 16 weeks duration between the first and second shot, but it's not interchangeable. It should be the same type.
Thank you. So the next question is, can my kids get vaccinated at this time, or when phase 3 starts?
Unfortunately, the approval of the vaccine, all the approved vaccine, so Pfizer 16 and up, and for the other 3 is 18 and up. So they are not approved for kids yet. Hopefully, clinical trial is going, and we can see some information in the near future. But right now, no.
Thank you. So the next question is, do I need to get the vaccine if I've already had COVID?
Yes. So if you have COVID, once you are not contagious and you are cleared by the public health, you can come and you can get the vaccine when your group is being targeted in the mass immunization. What I want to say, I think I may saw a question in the chat box. So if you get any vaccine, like for example, shingles, measles, or something like that, you wait for 2 weeks and then you start, and then you get the COVID vaccine. If you get the COVID vaccine, you have to wait 4 weeks, and then you can get the routine, any other routine vaccination, if it's indicated.
Thank you. And so our last question is, you touched on it a little bit, but what is herd immunity and why is it so important?
Herd immunity, it's like by developing immunity against the virus. So 80% or more of the people, they have immunity, so that will minimize the transmission minimize the risk of symptomatic infection, hospitalization, and death. It can be reached by infection if there is no vaccine, but right now the light at the end of the tunnel become more bright now with more vaccines being available. So hopefully we enroll the mass vaccination right away, and that will give us the herd immunity to control the outbreak. I mean the pandemic, sorry, the pandemic.
Thank you so much, Ms. Shala and Dr. Balhaj. So we'll now start our question and answer period. Before we move on, I would just like to announce the winner of our social media contest. So thank you to everyone who participated to help promote this town hall. We received a lot of engagement and various submissions. So the rules of the contest were to like the post, follow SCHC, and tag 3 friends in the comments of that post. If you entered on multiple platforms, for example, Instagram, Twitter, you would have earned more than 1 entry. So there was a random draw that was done, and the winner of the contest is Luxana, who entered via Instagram. She's been contacted about her prize already, but stay tuned for her social media for future giveaways and future town halls. So for our Q&A section, we'll first go through any questions received in the chat box during the event, and then we'll open the floor for more questions and discussions. So for this section, I want to welcome Abinaya Anurubin and Jessica Jing, who will be helping us. Abby is a successful graduate from the University of Guelph Humber with an Honors Bachelor of Applied Science in Early Childhood and a Diploma in Early Childhood Studies. She's currently working as an outreach worker with the City of Toronto's COVID-19 Outreach Rapid Response Team. Jessica is a registered nurse and nurse educator with SCHC. She's been serving the community as a nurse educator for 8 years, and she also holds a medical doctor degree in China in the field of internal medicine.
Thank you, Vinofa, for the introduction.
No worries. So I'll start with the chat box questions first. Let's see. One second. So one question that we received, any of our panels can answer, is do you get to pick what kind of vaccine you get, or which, for example, Pfizer, Moderna? Any of our panelists, you can just go ahead.
Yeah, I can say that wherever available. As I said, we don't wanna keep a vaccine in the fridge or in the freezer. All vaccines are equally effective in preventing death and severe infection and hospitalization. So whatever vaccine available, we're gonna give it right away. So I don't think there will be choice, but it depends on the availability.
Okay, thank you. So another question I received is, can cancer patients get the vaccine?
Yes, cancer patients, they can get the vaccine. They need to consult with their oncologist. The vaccine will not harm them if they are severely immunocompromised because of chemotherapy. They may not develop high immunity, but there is some immunity from the vaccine. The vaccine will not harm them, but they need to consult their oncologist.
Thank you. Another question we have is, how long should someone wait to get a vaccine after they had COVID? I think this was touched upon a little during the event.
Yes, it was answered, yes. So once you are clear or you are not contagious, that means the infection is resolved, you can get the vaccine. So like if you have any infection, for example, pneumonia, urinary tract infection, ear infection, your immune system is busy with the infections that you have now. If you get the vaccine, your immune system will not respond to the vaccine. So once the vaccine is over, once the infection is over, any kind of infection, and then you can get the vaccine and your immune system will respond to the vaccine.
Thank you. So another question we have is, with the vaccine now available at some pharmacies, can I get vaccinated at one and get my second shot at another pharmacy, or does it have to be at the same pharmacy?
I'll take that one, not because I know the answer. The pharmacy program has really just been announced in the last 1 or 2 days. So I don't think we've seen the answer to that question yet. It's a good question, but I'll be honest, we don't know at this point.
Thank you. Let's see. So one question we have is, will there be any interaction between COVID vaccines and other vaccines? For example, if someone takes allergy vaccines weekly?
There is no interaction. As I mentioned, if it's like for routine vaccination, you need to wait 2 weeks to get the COVID vaccine. And after the COVID vaccine, you have to wait 4 weeks to get any routine vaccination, but there is no interaction. The issue is like just to develop immunity, because if someone had shingles vaccine, they need 2 weeks to develop immunity to that. After that, their immune system is not busy, so they can get the COVID vaccine and they develop immunity to it. And after 4 weeks, the immune system become less busy with the COVID vaccine, and they can respond to another vaccine. So it's not an interaction, it's just a response to the vaccine.
Thank you. So we also have here, can people with autoimmune diseases such as lupus get the vaccine, or how might it affect them?
I don't want to answer every question. So if Dr. Ahmed wants to answer any question, he can jump in. But again, autoimmune, it's also, they can get the vaccine. There is no contraindication. They need to talk to their immunologist and they can get the vaccine. It will not harm them. They will develop immunity.
So the next question we have is, will SHN be setting up a pre-registration website like Sunnybrook or Michael Guerin?
Hi, I could take that one. We actually are on the same, platform now. Sorry, can you hear me okay?
Yeah.
Oh, okay. I was hearing a bit of echo there. Yes, there is now one common website for all of the hospital-based clinics in Toronto. And when you go on that website, you'll be able to click which clinic you want to find out about. So Scarborough Health Network is part of that now. And so you'll get information on by priority group, as we talked about earlier. So the groups that are eligible to pre-register will be able to do so. And right now we have we have our main Scarborough Health Network clinic at Ellesmere and Nielsen, which is our centenary site. And that has been operational since December. We've been vaccinating healthcare workers since December. And on Monday, we just opened up our Centennial College site, but it's not at full capacity yet. It will be one of our largest sites, but we wanted to just test things out first before we opened it up. So we're doing a small amount of vaccines a couple of days this week at Centennial, but by next week that should be available also for the priority populations. So you'll see them on the website. And the other one that's on the website right now is Care First Seniors Association in North Scarborough. They're not open yet, but we're just planning ahead for them to be open very soon. So they're on the website also.
Thank you. So another question we have is, will the website or the registration portal state which vaccine they are administering before you sign up?
Well, you will get that information at the clinic. I actually am not sure if it's on the website. That's a really good question. I'll check into it. But I guess the question is, will you know ahead of time which vaccine? We have a phone number as well. But basically at our, what I'll call our stationary clinics, it's going to be Pfizer. For now, it's going to be Pfizer. Because Moderna is a little bit easier to transport, we've been using Moderna more often when we go out of the hospital. Like if we have to go into a long-term care home and vaccinate people living in the long-term care home, we took Moderna. But for anyone coming to our clinics right now, it's going to be Pfizer.
Today, the Ontario government said they are prioritizing people from 60 to 64 for AstraZeneca, and that will be delivered to 327 pharmacies. So yeah, so at the pharmacy, if you are getting your vaccine in the next couple of weeks, if you're getting your vaccine at the pharmacy, you're getting most likely AstraZeneca, and yeah, and that's specifically for the age group of 60 to 64.
That's correct. Yeah. And I see that Jeannie has put the website for the pharmacies in the chat.
So the next question we have is this a one-time vaccine, or does it have to be annual like the flu vaccine?
No one knows the answer. We don't know the vaccine for how long it will be effective. Only time will tell. So it's a good question, but we don't have the right answer for it at this time.
This has a layered question. How are we going to respond to the current vaccine? If the current vaccine gives us high level of protection and the vaccine in the virus in the community dies out, that means less likely. But if it keeps on going on, most likely. So it's wait and see kind of a game right now.
So another question we have is, can you get the vaccine while you are taking antibiotics?
So if you are taking antibiotic, that means you have some sort of infection, and your immune system is fighting that infection, right? So if you get the vaccine, you may not develop the right immunity. So it's better to make sure your infection is under control and it's resolved, then you get the vaccine. So it's not because of interaction. It's just because your immune system is busy with the infection. It may not respond well to the vaccine.
It looks like we covered all the chat box questions, so I'll open it up to our guests. So if you have any questions, you can go ahead. If you can raise your hand or you can unmute yourself. Again, we do have translators available, so if you would like to ask your question in Tamil, Cantonese, or Mandarin, you can go ahead.
I have a question.
Yeah.
I was wondering, does the vaccine contain any animal products? Because I'm a vegan.
These vaccines, the available vaccines, none of them has any animal products. I'm a Muslim myself. I'm very careful. I did my own research before getting the vaccine. None of them has animal product. It's halal, it's kosher, and it's good for vegan. Yeah, no animal products.
And has it been tested on animals at all?
This is meant for human use. I don't know whether it's used in animals.
Yeah, you know, Ahmed, when they started first, during the first like stage 1, the trial, they use it for animal to check if develop immunity before they used in a human. It's just part of developing any virus. They start with testing it in animals, then they move to a human.
Okay, I see. Thank you.
So it looks like we have one more chat box question. So I'll just read it as is. My mother-in-law is almost 99 and living by herself in Pickering. She has an appointment to get her first shot in Ottawa, and my husband is her primary caregiver, but he is only 66. Is there any way he can get vaccinated sooner rather than later?
This is a good question, I think, and maybe Michelle can. And why she's gonna go all the way to Ottawa for vaccination? I think if she lives in Pickering, I think we can arrange for. Oh, sorry, in Ottawa.
Oh yeah.
Okay,
I had the same thought. I live in Pickering with my 80-year-old mother, and she's not going to Ottawa. Yeah, that question has come up a lot. Is what if you're 80 and your husband's 79 and a half, and or you're a caregiver, and also when we've looked at doing apartment buildings that have a large percentage of seniors, the question is, while you're there, shouldn't you just do everybody regardless of age? So that is a question about what if one person is in the age category and the person that's with them is not. And I do happen to know that different clinics are taking a different approach. We're trying to do what makes sense. And it does have to do with vaccine supply as well. So if they go to a location that has a lot of vaccine supply, maybe they will, because we vaccinated essential caregivers in long-term care homes, but we don't have any direction to vaccinate essential caregivers in private homes. So based on the written guidelines, the answer might be no, but I think practically speaking, if someone at a clinic heard their story and their situation, it might be possible, but I can't guarantee it. It would depend on the clinic and how much vaccine they have. Is it at the end of the day when, they have a couple of doses left in the bottle, and rather than throw it away, they'll say, oh, let's give it to the person. So there are a lot of different factors.
So I'll take a few more chat box questions. One is, I'm working at a building with 400 seniors. Will SHN go to these types of buildings?
Yes, we're working on that strategy. Yes, we're creating, not creating, we have a mobile team, and we will be going out to different settings, especially for individuals that might have a hard time traveling to us. Our focus the last 10 days has been going to shelters. So we have been vaccinating the people that live in shelters or people who are homeless. And that's because that was the direction from the ministry to prioritize that group. So when we have enough vaccine that we can take out to all of the seniors buildings, we will start to look at that as well.
Another question we have is, would it be safer for someone with lupus to get the one-shot vaccine as opposed to the 2-dose?
Sorry, what do you mean by 1 dose?
I believe they meant some of the manufacturers are only 1 dose. As opposed to like the Pfizer. Yeah.
I think the vaccines are equally effective in preventing severe infection and death, but for mild and moderate, Moderna and Pfizer may be slightly better, but any vaccine can be given in a patient who has lupus. It's only Pfizer available now, so we haven't started ruling out the other types of vaccine yet.
So another question is a little similar to the one before. For individuals with disabilities who have caregivers, would their caregivers be entitled to get a vaccine even if they're not currently eligible?
Yeah, I think that's very similar to the question about the lady whose mother-in-law lived in Pickering and wanted to know if her son could get the vaccine.
Hello, I have a question. Now, after having the first dose and the second one, do you issue a small card stating that you have done those COVID-19 vaccine? So in case you would want to travel outside Canada, you have something to show that you have done that?
Yes, you do get information showing that you've had the vaccine. And then you also get, after the first dose, and then you'll also get a printout with the date for you a date and time to come back for the second dose. So
all right.
Yeah.
Thank you so much.
So we have one more chat box question before I move on to those who raised their hands. And this is on the COVID Equity Action Plan for Rhea and Jan. So the question is, there are people in our community that don't know about the support programs. How can we help, or how can we spread the word?
Okay, so I can give you the number, and I can write down the phone number and also the email address. And the phone number, if somebody needs help regarding the COVID program that we are running. So the phone number is 416-736-9372. I repeat the number, 416-736-9372. And they can also write email to us if they want. So the email is COVID Equity COVIDEQUITY@scscontario.ca. I'm going to write, this email address and phone number on the chat box. Thank you.
Thank you.
Thank you, Jen.
So we'll move on to those who raised their hands. I'll start with Ingrid. You can just unmute yourself and go ahead.
Thank you. And thank you for putting this venue out so we could have so many questions answered. I still can't find the website address for if I want the timelines for the age groups and the locations and how to register. I thought you said it was posted, but I don't see it.
Okay, I will find it and put it in the chat for you, Ingrid.
Thank you very much.
You're welcome.
So next, I'll get Agnes Wong. You can just go ahead and unmute yourself.
Hi, I'm not sure because I put this question in the chat box. I'm not 100% sure if this is missed, but I'm just gonna ask it here. Is my dad is senior, who is 88, and he has got Alzheimer's, so he doesn't really understand what's going on. So if I take him to a clinic for vaccination, I'm afraid that he will get really grumpy because I can't really control his behavior because he doesn't wear a mask, or he just got grumpy when he has to line up for waiting. I'm just wondering if there is any special arrangement for this type of patients, or is there some suggestion that I can do with him?
It's Michelle. Sorry, that's what I get for multitasking. I was looking for the website. Sorry about that. That's a really good question.
You have to pre-register.
Yeah, I mean, we you would be able to accompany your father. Is it time of day, or are there certain times of day where it might be easier?
Yeah, of course. Yeah.
Yeah.
I can do it anytime. It's just that I don't see there is any special announcement on the website or anything that is special handle for this type of patient. I'm just.
Yeah. And I wonder, like I said, we are building up our mobile teams so that we will be going, and I don't know where your father lives because we're actually focusing on going to places where there are large numbers of seniors in one place. So he may live in a house. I'm not sure if that would meet his need.
Yeah.
Pardon me?
We live in a condo. He's in Scarborough area.
Oh, okay. Because we will be getting to condos. Are you able to share if your father receives home care?
Yeah, sure.
He does? Okay.
Yeah.
Because we're also coming up with a strategy for individuals that are receiving home care and they are unable to leave their home. So he may fit into that category as well.
Oh, okay.
We're still working that out. We're working on a partnership with EMS, the paramedics. They're going to be supporting the strategy of going to people's private homes.
Okay. Sorry.
So it's just, I'm sorry that things are still kind of evolving, so we don't have all of the details of that piece worked out yet.
Oh, that's good. That's good enough. Thank you. I as long as there is plan, then I can really wait. Thank you.
Okay.
Thanks.
You're welcome.
So next I'll move on to knowledge. You can just go ahead and unmute yourself.
Thank you. I don't so much have a concern of taking the vaccine, but I do in the sense I am between the ages of 60 to 64, and the one that they are suggesting for my age group, I am not comfortable with that one and I don't want to take it. I don't mind the Pfizer or the Moderna. So my whole thing is, how do I go about that? Because if I'm not going to get that, I would not take any. I would not take any. I do heard both of the doctors speak and says they all are just the same, but I guess maybe at my age and my mind or my mindset, I just don't feel comfortable with the other two. So with that, I may be one of those people who would not be taking any if I can't get the one that I feel comfortable with.
You'd be sorry.
No, don't say that.
Somebody said sorry? Sorry about what? What is the person sorry for?
We're not taking it.
Ooh, no.
Why are you sorry for not taking it? I should have an option and a choice.
Yes.
That's what I said. I don't feel, I didn't say I would not take it. If the one that I am comfortable with is available for me, I would take it. Outside of that, right at this time, I don't feel comfortable with the other two.
Leave it to God.
God is not going to come down and vaccinate me.
Yeah, I mean, you know what? This question
And
is
right
gonna
now,
come.
I
Yes,
am
yeah,
trusting in God. That's why I have not got infected and I've taken all my precautions. So
Yes,
I trust in God and I'm trusting in Him. That's why I am safe thus far. But also He gives me wisdom.
Okay. This is a good question, you know, and the question is gonna come up again and again, but I don't have the right answer for it. So I don't know if it will. If you most likely once the vaccine become more available than now, you will have the choice. But I don't know at this time. I don't have the right answer for it.
So we'll move on to Ms. Letna. You can go ahead and unmute yourself.
Everyone, good evening. Thanks for having this forum, and thanks for inviting me, and thanks for giving me the opportunity to ask a question or two. I have two questions. First one, I might put them in the chat. I am predisposed to shingles as a hereditary factor of my mom. And I did 2 shingles shots, one on October 1st and the other one in late January, early February. And the first one I got severe backlash from it. I was out for about a week. People thought I had COVID when I did it. The second one, I was out for 2 days. I am in the batch to take the vaccine within the 62 to 64 years batch, which is the one that is going on over the pop-up shops. What are the dangers for me to take the vaccine at this time? Is there any danger? Is there be any counteraction between the Shingrix and the COVID vaccine?
Yeah, this is a good question. Just I want to tell you that shingles vaccine is live attenuated virus. So when the shingles vaccine, they give you a weakened virus, so it will produce immunity against the shingles, against the shingles. So the side effects may be more because it's a weakened virus, a lot of immune response going on. COVID virus does not have a virus. It's not alive attenuated. It's not killed. It's so I would expect the side effect from the COVID vaccine would be way less than the shingles. And if you get the shingles vaccine today, you can get the COVID 2 weeks after the shingles vaccine. So I heard you take it the end of January. So
Yes.
at any time now you can take the COVID vaccine.
Okay. And my next question is, with the scare that Black people, Black and brown people, especially Black people, are having in taking these vaccines, which I don't know why people are scared of it. It's like any other vaccine, I suppose. But what percentage of Afro-Caribbean are taking the vaccine, especially in Scarborough?
That's a really great question.
Yes.
And if you ask me that in a week or so, I might have a better answer. Because the good news is that now that system that I mentioned, the COVAX system for all of Ontario, now that that's going to be up and running on Monday, and they are going to be collecting race and other socio-demographic data. so that we will all have a much better idea of who is getting the vaccine and who isn't, so that we can implement targeted strategies. So they will be asking, and it will be voluntary. So you don't have to answer these questions in order to get the vaccine. I just want to make that clear. But they will be asking questions about race, ethnicity, income level. I think they heard household, how many people live in the household. So that's information that we really haven't had before. We don't collect a lot of race-based data across the healthcare system.
Yeah.
So that, I think that's a real positive. So we will be able to get data like that in the future, but we don't have it today.
Okay.
I would like to add one point on this. Our community has been affected significantly, both here and in the States. A lot of people of African and Caribbean descent have been affected by COVID, both hospitalization and even death. And we have to make sure that our community understands that these vaccines are safe, and we should not be left out on the available vaccine when it's rolled out. And we have to educate our community and reach out and try to answer their questions and concerns. And yes, and we have to make sure that we get our information from the right sources. Yes, there are lots of misinformation out there in the community. Let's try to tackle those myths together so that our community will not be affected, please. Thank you.
I just want to answer questions that it came. If you are taking antibiotic to suppress infection, that means you don't have active infection, you can get the COVID vaccine.
So I'll
Thank you.
I'll take 2 more questions before we wrap up. Any unanswered questions we have, we will be answering and putting in a FAQ on our website. So I'll put the website in the chat box right now. And the next question we'll take will be Pashmina. You can go ahead and unmute yourself.
Yeah, hi there. Thank you so much, Jam, for can you hear me?
Yeah, we can hear you.
Perfect. Yeah. So thank you so much, Jam, for providing the information. And I want to share. I want to ask that is there any community engagement or community involvement program is going on with the SCHC, where they are training people who can go out in the community, providing awareness related to the vaccines, distributing the flyers, distributing the mask? Because I personally think that this is still needs to be done. There are so many people who are not well aware of the benefits of this vaccine, and still they have so many doubts about wearing mask and hand sanitizing. Still we are in the middle of getting vaccinated. So is there any team there, or are you guys thinking to developing a team especially to making taking people from the community, engaging them so they can work with SCHC in helping especially our Scarborough community?
Thank you, Tasmina. This is really a good question. So let me tell you one thing. The basic theme of this project is the community engagement. So we have in this project 11 people working with us, and out of 11, 7 people are community engagement worker. You can say they are community engagement worker, outreach worker. So this project started in January, and I don't know, it's going to be maybe in May or June. Maybe it's going to be extended, but so far, we are running this project in high spirit. And we are working, as I said, south of Scarborough. So there are 3 organizations. So we are working, our catchment area is from 401 to south side of Scarborough. And every day, every day we are spending 4 to 6 hours. So 7 people every day go outside from their home. We go to subsidized building, we go to grocery stores, we go to shelters, men's shelter, women's shelter, all in Scarborough South Side, as I said. And we distribute, so far we have distributed thousands of masks free of cost. And we are also distributing hand sanitizers, flyers. There are 5 or 6 flyers. Every flyer has just different information. We are providing them in these flyers. So they, if they have symptoms of, COVID, so which center they can go, what date. So we are providing whatever information we have, and we are contacting everybody, community leaders, religious leaders, and community organization, ethno-based organization. We are specifically targeting, as I said, South Asian population, Middle Eastern population, and African. So they are our target population.
And maybe I'll just jump in. It's Jeannie here from SCHC, because that's such a wonderful comment and insight, and we're really looking to expand and build that. And Michelle leads one of the teams that is looking at ways to really leverage and use our community residents, ambassadors, faith leaders, a very comprehensive, large strategy to try to reach to all the people to help do what we're doing here tonight, really educate around the vaccine, build that confidence, answer the questions, provide a lot of the PPE and supply that Jem and Rhea are doing, as well as their colleagues. So we're going to be seeing more of this approach definitely over the coming weeks and months as we work to really get more and more people vaccinated.
I just want to ask one more thing. If someone wants to become an ambassador, so how someone can do that?
So if you're interested, I suggest you can connect with us offline, and as opportunities arise, we'll loop you in and see how we can get you involved. Really appreciate that.
Perfect. Thank you. So the email address that Jem has provided, on that email, someone has to contact, or what?
I'll put another email in the chat box for you.
Perfect.
More
Thank you.
direct, so it doesn't get lost. Okay.
Thank you.
Thank you.
So next we'll take Debbie's question. Debbie, you can go ahead and unmute yourself.
Okay. You said before you get the shingles, you have to wait 4 weeks after your COVID. Is that after the first shot or the second shot?
After the second shot.
Okay. Okay.
Donna, you can go ahead with your question.
How does one get to ask a question?
Hello, it's Donna. I have a question. I can't find the Scarborough Town Center site on any of the websites that I went to today. I went to the Toronto website, and then I went to the Ontario website. I don't see the town center location there. And my question was, it's been my assumption as well that hospitals will have likely Pfizer and Moderna. Will those large COVID centers be the same case with AstraZeneca going to pharmacies and primary care doctors?
Right. Those are great questions, Donna. So we're really fortunate in Scarborough that there, in addition to what the hospital and the community agencies are putting together, as you know, we're going to have hopefully 6 clinics that will be run by the hospital and community agencies like Scarborough Center for Healthy Communities and Taibu and Care First. And we're going to have one at Centennial College. We're going to have one at U of T Scarborough campus. But in addition to that, the city of Toronto through Toronto Public Health, they will be running 2 large mass vaccination clinics in Scarborough. So that's what you're referring to. So one is Scarborough Town Center and the other one, it will be at Malvern Recreation Center. The Scarborough Town Center location is not scheduled to be open until March 17th. So that's why there wouldn't be information on that one yet. And they will be ramping up and doing quite a bit of vaccines. So what that tells me is more than likely it's going to be Pfizer, because from the volume of doses that I've seen, it could only be Pfizer. We don't have that much Moderna, and we definitely don't have that much AstraZeneca. So that may change in the future. But hang tight, they're not scheduled to be open until next week.
And then if you could just unconfuse for me where I sign up. Do I go to the Centenary Hospital site and sign up there? Do I wait and sign up at the town center one? Are they all being merged? Or should I be really thinking hard about which one I pick now?
Right. I think it may depend too on which group you fall into. In terms of, are you over 80 or, or 60 to 64 or a different group. So each site will have its own, will list sort of the priority groups for you to check off which one you're in, because we want to make sure that we're doing the priority groups first before we do the groups that are less risky. So that's why we wouldn't know that unless we ask. So that's part of the registration process. So at this point, the Toronto Public Health clinics are not in the same system as the hospital clinics, but that may change by the time they are ready to open. They're just not ready yet.
May I ask one question, actually? If the panelists yes, now when COVID started, every website you go, there is a warning about where to get COVID information. Now there is a lot of confusion in the community, and it's very difficult for members of our community to get to go to this website or the other website. And there is a lot of barrier in education, access to computer, internet, all these things. So if they go to SHN website, right at the front, if it gives them the link to where to go for registration. If they go to on our website, SHC, and if SHC puts a link to where they can easily go to get their vaccination registration. The same thing, if we have to really make things easier and remove barrier, especially for those who have a barrier already.
Yeah, absolutely. And that will come. We're actually, as Dr. Belhaj was saying, we're still in phase 1. The mass vaccination program hasn't started yet. And so all of the things that are going to help us communicate when we're ready to vaccinate the community en masse, those things aren't in place yet. And I think there was information in the media saying that the provincial system for registering called COVAX, I believe they've said it will be available March 15th. So that's not till next Monday. So we've just been the Toronto hospitals just got together and we put together a little website of our own, but they've been saying that the provincial system will be available on March 15th. So hopefully that will happen. And then as we get more vaccine, because I think there is a danger in rolling out a strategy where everyone thinks the vaccine is available to them and it's not, right? We have to wait for the shipments to come in. So we're just trying to have everything line up so that we're not advertising too soon.
Yes, right? I just want to add that Glenn, our lead for vaccination program, mentioned that in I believe in North York General, they opened their website, 4,000 were registered, and there is no vaccine available for them. So once the vaccine is available, then you can advertise, you know. But
Yeah.
if you advertise and you don't have the vaccine, everyone is going to be like anxious and where is the vaccine when I get it? So it's better once you have it, then you advertise.
Yeah, that's what happened to my mom in Pickering on Monday. And she spent hours and eventually the system crashed. And she'd wasted all that time. She had to send a note to the mayor. But yeah, so we're trying to avoid those kinds of situations. And I know that it's hard. Everyone is anxious. I certainly appreciate that. But we'll just ask people to trust and be patient just a tiny bit longer.
Vinofa,
yeah.
it's Naomi D'Souza. How do I put my hand up? I'm not computer savvy.
Oh, you can just go ahead and ask your question since you're already unmuted.
Can I ask it now? I'm one of the few that have declined to take the vaccination. And I don't have any particular reason at this time, except that it's an instinctive feeling that I have. However, I've been watching the news, I've heard about the vaccinations, but nobody has told us how we can keep our immune system strong, how what we need to practice in our daily eating habits so that the body is strong, especially in long-term care, where they give seniors salads for dinner instead of soups that would keep their immune system strong, right? What can I say? There's also another question that I've never asked anyone. How does blood types act with these vaccinations? Like you have O type, A type, B type. We come from different countries. We have intermarriages. The blood system, the body system is different. And yet you put in one vaccine and says it will work right away and things. So it's a multiple confusion in my mind at this time. And if you can tell me where I can find this out as to how they test it on the different blood types.
Okay, so I'm just going to answer the first part of the question first. So I hope that I have the right answer to tell you what kind of food you take to prevent the COVID. Unfortunately, COVID is a spectrum of infection. Some people, they are like bedridden, they don't move, and they develop only asymptomatic infection. Other active people, they develop severe infection, they stay in the ICU and they may die. So it's a spectrum, we don't know the answer. I don't think there is any specific food or something like that will protect you from COVID. So that's why there is no treatment available yet, you know. The second question that, as previously mentioned, during the clinical trial, there are different races, visible minority being involved in the trials, some of them 20, other 30%, and the effectiveness of the vaccine is the same for them. So there is no, if you are, we are all a human, we are all have the same immune system, so we are not different, and we all have the same immune system, we should all have the same immune response. But if someone wants to find excuse, they will find. But I can tell you the vaccine is effective. And from our experience in long-term care, and Michelle, she also involved with the nursing home, we used to have like 10 to 15 outbreak in nursing home in Scarborough, and we have maybe none right now. And even if there are cases in the staff who are not vaccinated. The resident in the nursing home, more than 90% vaccinated, and we do not see cases in the resident. We see cases in the staff, even in the hospital. We see cases in the staff in the hospital who are not vaccinated. And if you get the vaccine, you will protect yourself from the COVID, you protect your family, and you protect your loved one. So it's important to get the vaccine.
Let me add on this one. There's no question the vaccines are effective and it's working. Look, Israel, where almost 95% of the population got at least one shot of the vaccine, they are very close to opening their economy fully. Number one. Number two, last Saturday in Netherlands, they opened up a concert where everyone gathered, thousands of people gathered to have fun and party. This is the effect of administration of vaccine, and see how the effects evolve. It's working. Let's come to Ontario. In the last 4 days, there is no single death from our long-term care. Our long-term care facilities are much stable right now than they were during the first case or during the fall and early part of this winter. So this is because of vaccine administration and vaccine effectiveness. Let's go to the United States. How many people used to die from in the United States? It was scary, like sometimes 4,000, 6,000 people a day. Now, Dr. Fauci today said, we might probably go into some sort of normal state even before we reach some sort of herd immunity. This just tells us that there is a light at the end of the tunnel, and we have a collective responsibility to work together in cooperation to get out of this lockdown on, lockdown off situation. And there is no question the vaccines are effective and they work.
So thank you to everyone. If you still have unanswered questions, you can please put it in the chat box and we will answer them and post them on our website. So to close, I just wanted to welcome the CEO of SCHC, Jeannie, to give us a few closing words.
Thank you, Mrna, and thank you to all of our participants tonight, in particular our community members that have presented with such very thoughtful and important questions. It feels very hard to say we need to end the town hall, but it definitely reminds us that very good opportunity to have another one. But as Mrna said, put your questions in the chat. We'll also share an email address. We'll respond to the questions and answers and also send them to all the participants here tonight, in addition to putting it on our social media, because that may not be accessible to all of you. I also want to thank all of the speakers tonight for giving not only your time and your knowledge, but also some of your own personal experience and stories. I think that's always very important to hear and really helps to answer a lot of our questions. So I won't take up any more of your valuable time. Thank you to the Planning Committee, and I look forward to another opportunity to come together in another town hall and give folks an opportunity to answer some more questions. So thank you everybody very much for your time. Have a good evening, stay safe, and look forward to talking again. Good night.
Thank you, everyone.
Bye, everybody. Thank you.
Thank you, everything. Yeah.
You also.这个相处的还给我好事啊！去到以后看我就就你问题嘅点叫佢啊，我嘅是两头都瞧着。